Yes, Dr. Probst, dear colleagues, thank you very much for inviting me here. I feel deeply honored, and after the past 2 days, I must say, I feel also very inspired and grateful. A little bit about myself as a person. I'm a trained anesthesiologist and pain therapist from Germany. I left Germany in 2010 for Switzerland to work in integrative medicine, where I then ventured from mitochondrial therapy to inflammation to oncology. And in 2018, we started having very funny situations in Switzerland with regard to the press. Things that were usually only going on in Germany started happening in Switzerland, where there were very inaccurate informations on complementary medicine being spread, causing a lot of insecurity. And that was the point where I said, if I have ever a chance to explain about complementary and integrative medicine, I would leave my practice, I would go and do it. And someone apparently was listening to that. And I got a phone call, and someone requested me to do that. That was Iscador. And I said, okay, this is a remedy I have worked with. I've seen what it can do for cancer patients. And if I can help communicating what it can do to my colleagues and my patients, I'm ready for it, and that's why I'm here today. Thank you very much. So there's a lot of research on mistletoe. Mistletoe is the best researched plant in integrative oncology, and it would exceed the scope of this lecture to analyze the more than 200 clinical and preclinical studies. But if you have time, go on PubMed. You find a lot of interesting stuff to read. I have just brought you a collection of studies that were published within the past 10 or 12 years to give you an overview of what's out there on the data. And it's really interesting to state that complementary modalities that usually focus on the individual patient perform or tend to perform much worse than they would actually do in the really artificial surrounding of a standardized clinical trial. It's important to keep that in mind. And it's really impressive to see that still under these conditions, mistletoe as a so-called normal medical intervention can perform very well in clinical studies. Yes, so that's what we are going to look at now. First, but a little historical background on mistletoe. It goes way back for a long time, more than almost 120 years ago. Rudolf Steiner was a person who first did some research on mistletoe, but more from a philosophical point of view. And in 1917, there was a lady, Dutch Dr. Ita Wegmann, who learned about the properties of mistletoe from French colleagues. And she talked about that with Steiner, they knew each other, and she then developed, together with a Swiss pharmacist, she was based in Zurich, the first injectable mistletoe preparation and used it on her patients. And that was an ethanolic extract and must have hurt a lot, but it already showed some promising results. And from 1920 onwards, Ms. Wegmann and Rudolf Steiner worked together to advance integrative medicine and mistletoe therapy and pharmacy. And this led to, in 1926, the registration of Iscador as the first registered mistletoe extract. But the story didn't end there. Ita Wegmann and a person called Rudolf Hauschka, you may have heard about, and some other colleagues, founded an institution, the Society for Cancer Research, near Basel, to advance integrative oncology and do more research. In 1970, Veleda, you also probably know, took over the marketing and distribution, while the manufacturing was always done by the Society for Cancer Research. Thank you. In 1963, there was an oncological hospital that was founded by the society, which existed up until 2014. When many economical things happened in Switzerland, it had to do with the DRG, and the hospital had to close. In the same year, however, also the society decided to repurchase the distribution rights from Veleda and founded Iscador AG, which is the company I work for today. The Society for Cancer Research keeps on researching, and in 2020, it registered its first newly developed product after many, many years, which is a mistletoe cream to be used on skin cancerous lesions. To this day, the Hiskia Institute and the Society for Cancer Research remain the only independently funded, basically donation-based nonprofit research institution on integrative oncology in the German-speaking region. I'm also not aware if there are many others, but just so much. And they have a very nice new homepage you may want to visit if you're interested. Yes. Oops, this is not supposed to be, okay. So the first study I wanted to present to you was done in 2014. It was actually a pilot study done with 20 patients. And usually at this point, I always talk about a pancreatic tumor study, but we'll have a lot to talk about pancreatic cancer this coming year, so we skip this topic for now, and I start with this osteosarcoma study. Osteosarcoma is a highly malignant bone tumor, and usually after the second recurrence, the chance of surviving the next 12 months without a relapse falls below 20%. And in this pilot study, 20 tumor-free osteosarcoma patients after their second recurrence were randomized to a group receiving either Iscador for 12 months or, according to the guidelines, etoposide 6 cycles over 6 months. And the outcome that was measured was the comparison between the 12 months post-relapse disease-free survival in the two groups and the quality of life. And there was also a follow-up over 10 years for each patient. And so at the first time of the publication in 2014, only some patients were in follow-up up for about 5 years. And in 2020, the data was published showing the freedom from recurrence under Iscador in the follow-up up to 10 years after the study. The study was planned as a pilot study with only 20 patients because the recruitment took a lot of time because osteosarcoma is not such a common tumor. And 11 people received etoposide, 9 received Iscador, and Iscador was only used for 1 year in the study. And you see the trial in the box on the far left side with the curve indicating the relapse happening in both groups, blue being the etoposide and red the mistletoe group. And it is interesting to see that for the 10 years follow-up, the people who had not had any relapse under Iscador therapy during the course of the trial remained relapse-free. And basically, due to the challenge that this is a tumor where you are not really likely to get many patients into a study in a short period of time, the main study has not been even planned or carried out. I think this is a really impressive start to show what mistletoe can do. When it comes to quality of life, all the dimensions that were recorded between the two groups actually showed a benefit for mistletoe. Now we talk about the great studies, the big statistical projects of evidence-based medicine, while we keep in mind that evidence-based medicine is the integration of best research evidence, but always together with the clinical expertise of the treating therapist and the patient values. So we talk about systematic reviews and meta-analysis. The first systematic review and meta-analysis I want to present was done on the fermented mistletoe extract, and that is Iscador. It's the only fermented mistletoe extract available. And it's an update of a large-scale study that was done in 2012, and in 2020 the working group wanted to check if the findings from back then were still relevant. And this study was made by Thomas Ostermann from Witten-Herdecke. And it's open access, available. You Google something in PubMed, or you search something in PubMed, like Iscador survival, you will get the full text of this study. Here, 82 control studies first met the inclusion criteria, and 32 with 55 data sets provided the data that was possible to extract a hazard ratio. And hazard ratio means the risk of mortality in this case, the Iscador group or the mistletoe group compared to the control group without the mistletoe treatment. A hazard ratio of bigger or greater than 1 showing an increased risk, and a hazard ratio below 1 showing a risk reduction. And overall, in these studies that were able to be compared, the hazard ratio was 0.59, indicating a risk reduction to die during the course of treatment of 41%. And calculating backwards to the dimension of time, this corresponds to an average increase of 69% in survival time. So this is what it looked like. In all these studies, Iscador was given as an add-on to standard therapy. However, it's important to bear in mind that there were differences in tumor types, with the best reduction in the hazard ratio for cervix carcinoma and the smallest effect in lung cancer. And this is what it looked like, and it's important to note that even if the results in lung cancer were not really significant, patients still lived longer with mistletoe therapy than without it. There's always the question about data quality. And to address that, it was said that there was no significant differences between larger and smaller studies, no significant difference between older and more recent studies, a low overall risk of bias, and the only thing that mathematicians might want to criticize is that the studies weren't blinded, because studies on mistletoe are usually not blinded, because clinical effectiveness is expressed in a local skin reaction, where people will have something like a red dot on their belly where they inject the mistletoe. And it's important to note that even this might be the case, the survival time could not be affected by placebo effect, because if that were the case, we all needed to work much differently in our practice.
Sorry, what does bias mean?
Bias, Verzerrung, also Fehler in der Auswertung oder Fehler in der Datenanalyse. And also to address the question of placebo, it's interesting that mistletoe also helps patients that are unable to comprehend what's going on. It's also often used in veterinary medicine, and it's a common treatment of the equine sarcoid, which is a viral induced tumor of the horse, and there's no standardized treatment for that. And depending on the situation, the tumors can progress so that there's no alternative than putting the horse to sleep, and that can be a big and traumatic decision for the horse owner, at least, and the horse as well. So in 2010, there was, yes, there are very, very valuable horses out there, yes. In 2010, that was the first study to be published, and there's also a bigger study going on at the moment comparing per-oral use of mistletoe versus subcutaneous application in horses, which we will also learn about by the end of the year, and it's really interesting. But here you can see that the horses were treated and followed up over 5 years. And on the left-hand side, you see a very nice course of treatment, which is exemplary and very nice. Now we come to quality of life. That's classically regarded as the domain of mistletoe. There was a systematic review and meta-analysis done by Harald Wallach in 2020 using all the data available of all different mistletoe manufactured products to basically check if the claim was true. Also, this is open access available on PubMed with the right keywords. Or if you want to get the PDF from us, we can also send it to you. And here were included 26 publications with 30 data sets. In most studies, mistletoe was applied as an add-on to standard therapy. You can also see, basically, here the statisticians operated with a standardized mean difference for global quality of life scores, and with a standardized mean difference, the question is it negative or positive? It was greater than 0 on the average, and there were also differences for the different tumor entities. Breast cancer showed a 0.48 versus an overall increase in quality of life was 0.61. Overall, 50% of quality of life subdomains that are usually recorded in questionnaires, like pain or nausea, showed significant improvement under mistletoe therapy. Yes.
It's shortly after the lunch. I'm slow. The study with the horses.
Yes.
Was it under the conventional therapy, or was it just monotherapy with ASPED?
It was monotherapy because there's no treatment.
Yeah, okay.
Yeah.
Thank you.
So this shows the quality of life dimensions that are recorded in the EORTC QLQC30 questionnaire that's used in assessing quality of life in cancer patients. And the little bars with the stars indicate where it was particularly significant. You have the symptom score and the functioning score. And that's just an example how these functional scores work. They're recorded by questions like, did your physical condition or medical treatment have a negative impact on your family life or on your social activities, or were you restricted in your work or your daily activities or your hobbies or your leisure activities? And then there's a numerical score where people can just check the box. With regard to the data quality in this case, there was a high risk of bias due to this lack of blinding. And in fact, there were some studies where treatment was blinded. All in all, there was a greater effect in more recent studies and with longer treatment, and even in randomized and blinded trials. There was no significant difference between German or Swiss studies and studies conducted elsewhere. And in the conclusion, mistletoe therapy leads to a significant medium-sized effect and an improvement of quality of life in cancer patients. In the last year, there was another interesting meta-analysis by Pelzer and colleagues where they had extracted the data on fatigue that was recorded in these questionnaires, in these studies. Of course, cancer-related fatigue affects patients even after their oncological treatment is finished in their new status as survivors. and it can still lead to lasting loss of quality of life and long-term incapacitation. And of course, fatigue after the 2 years of the pandemic has a certain importance now for us. Fatigue is also measured with the same questionnaires and checking the boxes on a numerical scale. And on the right-hand side, you see a graphic that's extracted from the pancreatic cancer study I referred to, and that's a characteristical score where you see that over the course of treatment, fatigue that is just a symptom of the disease in the beginning is actually reduced. Even in this case, it was pre-terminal, late palliative patients with pancreatic carcinoma. Oops. Yes, and that's the meta-analysis done on 12 randomized controlled trials, where you also see that Mistletoe had the effect to lower the symptoms and lower the risk of, or the incidence of fatigue, even if the participants were not blinded due to the skin reaction in these trials. That also included all available Mistletoe extracts. All in all, in comparison with other therapies, the effect size was moderate or medium, and in fact still comparable to low-intensity exercise. We heard about the importance of exercise, and there's, in my opinion, no getting around exercise in the recommendation for treatment, but sometimes you have patients who are not able to do that. So it might be worthwhile to bear in mind that there is something that still can be done in that case with the aim to affect fatigue. You do not get all the benefits that you get from exercise that we heard about before the lunch break, but you get a positive effect on fatigue. What's always asked is the safety of subcutaneous mistletoe therapy. There we go a little bit back. There was a systematic review that was published in 2009 out of the data of 18 clinical trials with more than 6,800 patients. And here we have frequent report of adverse events with regard to the local reaction that's characterized through redness, itching, and swelling, which was reported in 16%, which means considering that it is a desired response that you see it is working, you get an immune response that is caused by an enhanced Th1 reaction on the site of the injection. It can get to a point where the patient still feels it's really annoying because it's a little bit painful on the belly, or maybe even at a site where you have the pants or something, and then they will report an adverse event. Systemic events usually look like flu-like symptoms or even fever, which can also be desired and used in treatment, but that depends on the therapist and the individual therapy concept. And under the normal therapy regimen that we have, the flu-like symptoms are actually signs of overdose or accidental overdose, because you can really steer the therapy nicely below these symptoms. And this should only be used if it's okay with the patient, if you have had that talk and it's part of your therapy concept. Allergic reactions are actually what everybody is afraid of, and it's good to know that they are really rare, well below 1%. And serious adverse events like angioedema or anaphylaxis, in this case, there was one recorded case in these 18 clinical trials, meaning a risk of 0.02%, which is about one-third of the risk of being struck by lightning when you cross the street. So just to get that right. There was also an internal analysis of our pharmacovigilance database, where we compared the data collected over 11 years. And that was something similar. Even with only our preparation, it was only a tenth of these incidents. Now, when I started to work for this company in 2019, I was really surprised because I had already worked with the preparation for a number of years, and I was aware that it's the best researched medicinal plant used in integrative oncology. And there were all these studies, but there were still these questions that people said, we still don't know how it works. And right, it only works if you really believe in it, right? It's something like esoteric or something. Or like, yes, you know it works, but nobody understands why. And that was just so frustrating because there are 200 studies and it's really well established. And so I'm really happy that there's this wonderful group in Poland. I know nobody from there, but I'm just really grateful that they did a systematic review 2 years ago, where they compiled everything that is known about the biological activity of mistletoe, all the in vitro and in vivo studies, and the mechanisms of action that are known. And that's actually also very worthwhile to read. It's also open access. Feel free to check if you have time. It's really, really interesting because it really goes down to the molecular mechanisms, and you get the feeling that your work as a therapist is really well supported. So the authors identified more than 50 studies from all over the world depicting various modes of action of mistletoe. Yes, and they really show how wonderful this plant works. Anti-carcinogenic, cardio-hepatonephro, neuroprotective, anti-diabetic, and so on. And you can see why it does that. And I'm coming to a close now with qualitative research that is in the process of being published. It's a study by Annika Mascher from Austria about how cancer patients experience mistletoe therapy. This was a qualitative study design according to standardized guidelines done on 20 outpatient oncological patients in a Swiss clinic who received 2 interviews. And to get the integrative dimensions right, it was asked about physical, energy, emotional, mental, spiritual, social levels. And then also included was the sense of warmth, which was something that the study designers had not planned, but that was something that half of the patients just relayed spontaneously. They said, well, this is so important and so special about mistletoe. And also, it's going to be very interesting to read, but it's something nobody would have thought of, that each and every single patient in the study reported that the mistletoe made them increase their self-awareness and their self-care, although there were many other differences between the people. So these are just some quotes. Like patient reported, today when I injected, I would say I feel much more present and warm. And I feel blood circulation, like everything in my body is warmer. Or the other patient said, it's like a little light that tells me, take care of yourself. It makes me aware of how I'm doing, because often something like that gets lost in everyday life. Or the third person saying, it gives me something as a person. It's not just about cancer. It's something that's good for me overall. It protects me and it strengthens me in my life. And these were just patients who had made their own experiences with the mistletoe. Yes, that is the part of the patient voices that gets lost or not heard when we just have them check the boxes. So I feel that's a really interesting study for all of us working with patient in their therapy. And that's the end. I hope I've not gone for too long. I want to dedicate this lecture to my mentor, Professor Herget, who kept me in med school when I really wanted to quit. And he was not only one of the pioneers in pain medicine in Germany, he was also a pioneer of microbiomal therapy. And we've talked about microbiome a couple of times already. Everybody's talking about the microbiome. And he unfortunately passed away 22 years ago. And he was ridiculed. He was laughed at. People thought he was crazy. I just want to tell you, all of you, go on, do what you're doing. We're doing the right thing. Thank you very much.
Thank you very much, Sarah Monz, for your outstanding presentation.
Thank you.
Are there any comments or questions about Mistletoe? So maybe I have a question. Do you know something about Mistletoe infusions?
Yes, I do. Mistletoe infusions is it's a long topic, and it really depends on which manufacturer preparation you use. So there are many, many differences between the preparations. And obviously, I could only talk about Iscador, and then I would need to really talk for another hour or so. So we might just do that talk another time. Because, yes, you can do that. It increases the efficacy of the mistletoe extract on the site of the tumor, but there are many, many things to bear in mind, because this is like it's a registered recipe for subcutaneous injection, so there might be certain side effects that happen with Iscador. And maybe not with other remedies, but maybe they have other side effects too, so it really, you need to talk to a specialist who has a lot of experiences with that, like someone who's now doing the next lecture.
Okay. Any other questions or comments? Ivan?
I just wanted to ask about the fermentation. You said that it is fermented, and the other products like Helixor is not fermented. Probably you were speaking now Helixor. What's happening there when it is fermented is one thing, and second thing, may this fermentation change the immunogenicity of the product? I'm asking because some patients react of Helixor quite heavily, and sometimes it's not possible to continue the treatment. You have experience that it may be replaced by Iscador?
It's the same, actually. So the first part, what does the fermentation do, is actually due to the fact that Ita Wegmann discarded the ethanolic extract because it was too painful for the patients to inject. And then there was the question of how to conserve the extract. And they just tried many things. And then they also tried fermentation. And it worked very well because the extract is stabilized through the Milchsäure, lactic acid. And also, apparently, it's unlocking some of the properties that are due to the protein extracts or the proteins in the extract. So, yes, we do have some of these in the Iscador preparations that are not in Helixor, and vice versa. There's a Belgian study by a working group where they did HPLC on all the extracts and actually showed, yes, you cannot compare them. They're totally different. They come originally from mistletoe, but then they're really different. And you have to really find the way which product is best for your patient, actually. And I think either Helixor or Iscador are good to start with. It's important to bear in mind that the host trees, like Helixor A, Iscador A, Helixor M, Iscador M, etc., just signify the origin of the tree where the mistletoe was collected, it does not say anything about what's inside the ampule. So these extracts are really, really different. So also, if you have a patient who doesn't react to Helixor M, you do not want to switch them to Iscador M. Just call us, we tell you which one to use, and not make that mistake to think that it's the same. Yeah.
Vice versa, the reaction is, there was overreaction. So you think that, and it was recommended to quit, so not to continue, so would you think about?
You could switch to another preparation and use the lowest possible dose and just see, because yes, the Helixor constituents are different from ours.
Yes.
And so it's just a, try. Yeah.
Maybe one brief question. Are there other indications besides oncology that you use the Mistletoe?
Yes. So basically, we also have I also need to say that first we have the registration for precancerous lesions to use it as a protective measure. However, then it's not covered by the insurance. There's a lot of off-label use going on. There's off-label use that basically pertains to all stimulation of the immune system, from natural killer cells to improving fatigue-related symptoms. And then also things like arthrosis, pain therapy. You see improvement in pain parameters in the patients who use Mistletoe due to the fact that they have beta endorphin release. So yeah, you can play with it on a number of levels. Yeah.
Last question.
Keine Frage. Darf ich Deutsch
Ja, klar.
sprechen? Ich bin Tierärztin und ich verwende es sehr viel. Und meine Tiere reagieren, die agieren nicht. Ja? Und die wenigsten Allergien macht Helixor A. Das sind die wenigsten Allergien, die ich gesehen habe. Ich gehe bis zu 100 Milligramm hinauf. Und ich toleriere einen Handteller, roten, großen Fleck und eine Schwellung. Wenn es mehr ist, gehe ich zurück wieder, bis die Reaktion geringer ist. Ja. Intratumoral, was man auch gut machen kann, ist Helixor P. Das ist das Beste dafür. Und als Infusion nehme ich auch A, weil das ist mir viel zu gefährlich, was anderes zu nehmen. Und da steigert man um 100 Milligramm die Woche. Muss man aber auch
genau. Wobei eben
so
diese...
600 Milligramm.
Genau. Also da muss man eben wissen, auch die Milligramm, die draufstehen, sagen, was ist reingegangen, nicht was ist drin. Wenn Sie gucken, eben die verschiedenen Herstellungsweisen und so weiter, Helixor A, dann käme Iscador P, dann käme Helixor M, dann käme Iscador M, und so können Sie sich können Sie sich peu à peu von der Dosis rantasten. Also die Dosis hat mit dem Buchstaben zu tun und nicht mit dem, was draufsteht. Genau, genau.
Es gibt keine Patienten, es gibt keine Therapeuten, es gibt nur Menschen.